Did you know that 3 common dental procedures recommended to seniors could be silently increasing your risk of heart attack and stroke after 65? In the next few minutes, I am going to reveal 3 routine dental treatments that most dentists perform without ever discussing the cardiovascular risks, especially for patients over 65 with existing heart conditions. Every single cardiac patient who came into my office with unexplained inflammation markers had undergone at least one of these procedures in the previous 6 months. Not because their dentist was negligent, but because the connection between dental work and heart disease is rarely part of the conversation. I am Dr. Bennett. I have spent 28 years in internal medicine and cardiology. I have watched healthy, active seniors with well-controlled heart conditions suddenly develop complications, not because they ignored warning signs, but because critical information about the oral cardiac connection never reached them. The procedures doing the damage were being scheduled in dental offices across the country, recommended routinely, believed to be purely beneficial. If you are over 65, especially if you have any history of heart disease, high blood pressure, or diabetes, stay with me. What I am about to share could protect your heart. Robert's story: how a routine cleaning triggered a cardiac event. Let me tell you about Robert. Robert was 68 years old when his wife brought him to my emergency department. A retired contractor from Arizona. Active golfer, took his blood pressure medication faithfully, had 2 stents placed 5 years earlier that were functioning perfectly. He was doing everything right. 3 days before I saw him, Robert went to his dentist for his 6-month cleaning. The hygienist noted some gum inflammation and performed what's called a deep cleaning or scaling and root planing. Robert's gums bled quite a bit during the procedure, but he was told this was normal. He went home, took some ibuprofen for the soreness, and thought nothing of it. 48 hours later, Robert developed a low-grade fever, fatigue, and what he described as a general feeling of being unwell. Nothing dramatic, nothing that screamed emergency, just off. His wife, a former nurse, noticed his ankles were slightly more swollen than usual. She checked his blood pressure. It was 168 over 94, elevated from his normal 130 over 80. That is when she drove him to my ER. We ran blood work immediately. Robert's C-reactive protein, a key marker of inflammation, was elevated at 8.2 milligrams per liter. Normal is below 3. His white blood cell count was elevated. His troponin, a marker we use to detect heart muscle stress, was borderline elevated. I asked him a specific question I have learned to ask every cardiac patient who presents with unexplained inflammation. Robert, have you had any dental work recently? He looked surprised. Just a cleaning 3 days ago. Why? Because, I told him, there is a well-documented but rarely discussed connection between invasive dental procedures and cardiovascular events in patients with existing heart disease. And I think that cleaning may have triggered what you are experiencing right now. We admitted Robert. We started him on antibiotics. Over the next 72 hours, his inflammatory markers came down, his blood pressure stabilized, and his troponin normalized. Robert did not have a heart attack, but he came close to developing what is called bacterial endocarditis, an infection of the heart's inner lining that can be life-threatening. When I reviewed his dental records, there was no notation that he had been given preventive antibiotics before the deep cleaning. There was no indication that his dentist had contacted his cardiologist. There was no documentation that Robert had been informed about his elevated risk as a patient with coronary stents. Robert, I told him, your dentist was not being careless. Most dental offices simply are not trained to identify which patients need cardiac protection before invasive procedures. The guidelines exist, but the communication gap between dentistry and cardiology means they often are not applied. We made specific changes. Robert now carries a card in his wallet that lists his cardiac history and states clearly that he requires antibiotic prophylaxis before any invasive dental work. He brings it to every dental appointment. His dentist now coordinates with me before any procedure beyond a basic visual exam. Robert is 71 now. He still plays golf twice a week. His heart is stable. But I think about what could have happened if his wife had not noticed those subtle signs. So what was actually happening inside Robert's body during that cleaning? Here is what most people never find out until it becomes personally relevant. The oral cardiac connection. What changes? After 65. After age 60, the relationship between your mouth and your heart becomes significantly more dangerous. The American Heart Association published guidelines in 2021 confirming what cardiologists have observed for decades. There is a direct biological pathway between oral bacteria and cardiovascular disease. Here is how it works. Your mouth contains over 700 species of bacteria. Most are harmless, some are protective, but certain strains, particularly those associated with gum disease, are highly inflammatory. When you have healthy, intact gums, these bacteria stay in your mouth. But the moment gum tissue is broken, whether through disease, injury, or dental procedures, bacteria enter your bloodstream. This is called bacteremia. The first issue is aging immune response. After 65, your immune system's ability to quickly clear bacteria from your bloodstream declines. Research from the Journal of Clinical Periodontology shows that bacteremia episodes last 40 to 60% longer in adults over 65 compared to younger patients. That extended exposure gives bacteria more time to reach and attach to vulnerable areas in your cardiovascular system. The second issue is existing cardiovascular damage. If you have any history of heart disease, artificial valves, stents, previous heart attack, or even just atherosclerotic plaque buildup, those damaged or artificial areas become attachment points for circulating bacteria. Once bacteria colonize there, they trigger inflammation and can lead to serious infections like endocarditis. The third issue is chronic inflammation. Periodontal disease, which affects nearly 70% of adults over 65 according to the CDC, creates a state of chronic systemic inflammation. Your body is constantly producing inflammatory molecules called cytokines. These cytokines travel through your bloodstream and destabilize existing arterial plaque. Studies published in the Journal of the American College of Cardiology have linked elevated inflammatory markers from periodontal disease directly to increased heart attack and stroke risk. The fourth issue is procedure intensity. Not all dental work carries the same risk. A visual examination carries essentially zero risk. A routine cleaning in someone with healthy gums carries minimal risk. But deep cleanings, extractions, and implant procedures create significant gum trauma and reliably cause bacteremia episodes that can last 30 minutes to several hours. The American Heart Association and the American Dental Association both acknowledge this risk. They have published specific guidelines about which cardiac patients need antibiotic protection before dental procedures. The problem is implementation. Most dentists do not routinely ask detailed cardiac history questions, and most cardiologists do not routinely discuss dental precautions with their patients. That gap leaves you, the patient, vulnerable. Now let me tell you the three procedures. Procedure 1. Deep cleanings, scaling, and root planing. 5 pulmonar, 45 6/5. The first procedure is deep cleaning, technically called scaling and root planing. This is different from a routine cleaning. During a deep cleaning, the hygienist uses metal instruments to scrape below the gum line, removing tartar and smoothing the tooth roots. It is often recommended for patients with gum disease or significant tartar buildup. The problem for cardiac patients is the trauma. Deep cleanings create bleeding and gum tissue disruption that releases bacteria directly into your bloodstream. A study in the journal Circulation found that scaling and root planing caused detectable bacteremia in 60 to 90% of patients, with bacterial counts reaching their peak within 5 minutes of the procedure starting. For patients over 65 with any of the following conditions, deep cleaning without antibiotic prophylaxis carries significant risk. Artificial heart valves. Previous history of endocarditis. Certain congenital heart defects, cardiac transplant with valve problems. Coronary stents placed within the last 6 months. The American Heart Association's 2021 guidelines specifically state that these patients should receive antibiotics before any dental procedure that involves gum tissue manipulation or periapical region perforation. The question to ask your dentist: before we schedule this deep cleaning, I need you to review my cardiac history with my cardiologist to determine if I need antibiotic prophylaxis. Can we coordinate that before the procedure? The safer approach. If you have gum disease, work with your dentist on a less invasive maintenance plan with more frequent but gentler cleanings combined with improved home care. Preventing the need for deep cleaning is always better than managing the risks of one. Procedure 2. Tooth extractions 650. 8. The second procedure is tooth extraction. When a tooth cannot be saved, extraction is often necessary. But the process of removing a tooth, especially a surgical extraction that requires cutting into the gum and possibly bone, creates significant bacteremia. The concern is not just the bacteria released during the procedure, it is the healing period afterward. After extraction, you have an open wound in a bacteria-rich environment. For the next 7 to 10 days, that extraction site is a potential entry point for bacteria to continuously enter your bloodstream. Research published in the Journal of Dental Research found that patients over 65 with cardiovascular disease who underwent tooth extraction without antibiotic coverage had a 2.8 times higher risk of experiencing a cardiac event within 30 days compared to similar patients who received prophylaxis. The additional risk factor is inflammation. Tooth extraction triggers a systemic inflammatory response as part of normal healing. For most people, this is manageable, but if you already have underlying cardiovascular inflammation from atherosclerosis or chronic conditions like diabetes, this additional inflammatory burden can destabilize arterial plaque and increase clotting risk. The American Dental Association acknowledges that high-risk cardiac patients should receive antibiotics before extraction procedures. The standard protocol is 2 grams of amoxicillin taken 1 hour before the procedure. The question to ask your dentist: given my cardiac history, what is your protocol for antibiotic prophylaxis before extraction? Have you reviewed the American Heart Association's guidelines for my specific condition? The safer approach. If extraction is necessary, make sure your dentist and cardiologist are coordinating. Ensure you receive appropriate antibiotic coverage. Plan the procedure when your cardiac condition is stable. Avoid scheduling dental surgery during periods of uncontrolled blood pressure or recent cardiac events. Procedure 3. Dental implants. 8 last 9 to 30. The third procedure is dental implants. Implants have become the gold standard for tooth replacement, and for good reason. They are durable, functional, and cosmetically excellent. But the implantation process is surgical. It involves drilling into bone, placing a foreign object, and months of healing. For cardiac patients over 65, dental implants carry 3 specific risks. First, extended bacteremia. The drilling and implant placement create trauma that releases bacteria. But unlike a cleaning where bacteremia lasts minutes to an hour, implant surgery creates tissue damage that can cause intermittent bacteremia for days or even weeks as the site heals. Second, foreign body colonization. The titanium implant itself becomes a potential site for bacteria to attach, similar to how bacteria can colonize heart valves or stents. If oral bacteria attach to the implant during the healing phase, they can create a chronic infection that continuously seeds bacteria into your bloodstream. Third, inflammatory load. Dental implant healing requires months of active bone remodeling. During that time, your body maintains an elevated inflammatory state at the surgical site. For patients with cardiovascular disease, this prolonged inflammation can contribute to plaque instability. A 2020 study in the European Journal of Preventive Cardiology followed cardiac patients over 65 who underwent dental implant surgery. Those who did not receive extended antibiotic protocols had a statistically significant increase in cardiovascular events in the 90 days following surgery compared to matched controls who had no dental work. The controversial part is this: current American Heart Association guidelines say that antibiotic prophylaxis is only required for high-risk patients. But many cardiologists, including myself, believe the guidelines are too narrow for seniors with multiple risk factors. The question to ask before considering implants: I am over 65 with a cardiac history. What is your experience managing implant procedures in patients with my risk profile? Will you coordinate with my cardiologist to develop a comprehensive prevention plan? The safer approach. If implants are recommended, ask about staged procedures with smaller surgical sites rather than multiple implants at once. Request a detailed healing protocol that includes antimicrobial rinses, close monitoring, and potentially extended antibiotic coverage. Some patients may need to consider alternative tooth replacement options, like bridges or partial dentures that involve less surgical trauma. Here is what I want you to do right now. 8 specific steps. 1. At your next cardiology appointment, ask specifically, do I need antibiotic prophylaxis before dental procedures? Write down the answer. Ask your cardiologist to document it in your chart and provide a letter to your dentist. 2. Create a cardiac history card that you bring to every dental appointment. Include your diagnoses, your medications, your cardiologist's name and contact information, and whether you require antibiotic prophylaxis. Keep it with your insurance card. 3. Before any dental procedure beyond a basic visual exam, ask your dentist, will this procedure cause gum bleeding or tissue disruption? If the answer is yes, confirm they have reviewed your cardiac history. 4. If you are told you need a deep cleaning, ask, can we break this into smaller, less invasive sessions? Multiple gentler sessions cause less trauma than one aggressive deep cleaning. 5. If tooth extraction is recommended, ask if the tooth can be saved through root canal or other treatment. Extraction should be the last option, not the first, especially for cardiac patients. 6. If implants are proposed, ask about success rates and complication rates, specifically in patients over 65 with cardiac conditions. Ask if the dentist has experience coordinating with cardiologists. 7. Improve your daily oral hygiene to prevent the need for invasive procedures. Electric toothbrushes, water flossers, and antimicrobial rinses can significantly reduce gum inflammation and decrease your need for deep cleanings. 8. Bring a list of all your medications, including supplements, to every dental appointment. Some medications like blood thinners require special protocols during dental procedures. Your dentist needs to know everything you are taking. I want to come back to where I started. My own father was 67. He had a history of atrial fibrillation and was on blood thinners. He felt fine. His teeth had been bothering him, so he scheduled an extraction with his longtime dentist. A dentist who had known him for 20 years. The extraction was performed without antibiotic coverage. My father was not told to stop his blood thinner beforehand. The extraction site bled heavily. He developed a hematoma, a blood collection that became infected. Within a week, he had bacteremia. Within 2 weeks, he was in my hospital with endocarditis. I am a cardiologist. I know exactly what happens when oral bacteria reach damaged heart tissue. And my own father underwent a high-risk dental procedure without proper cardiac protection because neither his dentist nor he understood the connection. We treated the infection. He recovered. His heart function stabilized. But I think about what that infection did to his already compromised heart tissue. Damage that cannot be undone. I made this video because I cannot be in every dental office when a hygienist says, you need a deep cleaning, without asking about cardiac history. But I can be here. If this opened your eyes, share it with someone you love who is over 65, especially if they have any heart condition. That share could prevent a cardiac event. Subscribe to Dr. Bennett Senior Health Tips for more information your doctors may not be discussing with you. I am Dr. Sarah Bennett, and I will see you in the next video.